Okay, so hello guys. Welcome to the webinar. Who am I? If you don't know already, my name is Faris. I'm a fourth year dental student currently studying at King's. I'm Egyptian. I think that's my most interesting personality trait. Liverpool supporter, because that's the only team you should be supporting. A YouTuber over at Faris Dent. Podcaster over at You Know The Drill podcast. Make sure you give that a listen if you haven't. It has some good content. And also I help with admissions, so like interviews, personal statements, all that stuff. So if you want more info about that, send me a DM on Instagram. Boom. So what will this webinar cover? Basically, it's just going to be quite simple. So interview question types, how to answer them, top tips to smash your interviews, actual, mock scenarios and the questions themselves, not just, like how to answer them. I want to actually go through it with you guys, and a Q&A at the end. I'm going to say it one more time, guys, please do try and get involved, or else there's no value in this. You could literally just watch this on YouTube after, which you should probably do as well. But try to get involved, ask questions, it's a safe space. Carabao Cup is ours. Okay, someone's getting a bit brave about Arsenal, but I'll let that slide. Okay, cool. So first off, what are the main interview question types? So interview types. So classically, they're split into two different types. So you've usually got your MMI, which are your multiple mini interviews, for all of you that don't know what that is. And then you've got your panel interviews, okay? So these are the classic ones because they're built to kind of extract the most amount of information out of you. With an MMI, you're usually set up at different stations. At each station, you get given a particular question. So you might have something like interview station 1, I'm going to ask you about a role play. And then once you finish that station, you move on to a separate station with a completely new interviewer, and that interviewer talks to you about something new. So you might be asked about, I don't know, why is leadership the most important skill in dentistry? Something like that. So the beauty of MMIs is that you have multiple mini interviews. So you have separated interviews at different, stations that allow you to be individually assessed at each station, okay? A panel is more of a classic style interview. With a panel interview, and yes, someone's asked, how do they do MMI online? Don't worry, I'm going to go through that now. In a panel interview, you are more based in like a classical style of interview, where you'll have a panel of people, so a few people in front of you, they will ask you questions relating to different things. A lot of the time they use your personal statement as a basis, or they might just utilize a few written questions that they have as a basis for the interview that you're going to have. So that one's a little bit more classical. Now, the fantastic question that was asked was, how will this be done online? Now, a lot of universities have opted to do a very new style of interview where they'll do like a blended panel MMI, where the panel isn't necessarily based on your personal statement, but they'll have like a set of questions that they'll ask you, and you'll have like a panel of people there. Or some universities also do like breakout rooms. So you'll have like one station is one room, another station is another room. But yeah, different universities are very different. Generally speaking though, you should really keep on top of your emails. So once you get your offer, hopefully when you get your interview offer, you usually get an outline of how it's going to be structured. But the premise is the same. You need to answer questions. You need to prove to the interviewer that you deserve a place at the dental school. And now I'm kind of going to go through some key methods that you can utilize to optimize your interviews, basically. Fantastic. So first off, what are the interview questions? Now, as you can see, hopefully you guys know there's the infinity sign. You can be asked anything, and I mean absolutely anything, in your interviews. You can be asked about, why is the sky blue? And why is Liverpool the world's best team? Like, you can literally be asked anything under the sun. So you need to be prepared for every single thing, okay? I just want to check if you guys can just let me know in the chat, like if anything's lagging, just so that I'm aware, because on my screen it's lagging quite badly, but I don't know if it's lagging for you guys. Oh, is it lagging? Is it lagging? Yeah. Oh, great. Something has to go wrong. It's all right. This is the beauty of technology. Okay. Am I back? Yes, I'm back. Fantastic. Brilliant. So yeah, so I was saying you can literally ask anything. Main ones though are the ones that I've stated on the screen. So things like role plays, ethical scenarios, examples of key skills related to dentistry, analysis of images and data, manual dexterity tasks, the infamous why dentistry, work experience, volunteering, research, NHS. And it honestly, like, just prepare for everything. But as that sounds quite daunting, we'll focus on like the main question types, just so that you guys don't start crying when you're trying to go through your preparation. Fantastic. So this is a method. This is a new slide for any of you guys that haven't seen this presentation before. It's called the SRR method. I just named it that this morning, literally. So a lot of the time, people have this problem where they waffle too much, and then I'll have a discussion with someone and I'll be like, you need to be more concise, and like, how do I do that? So this method is a tried, tested, proven way of ensuring you don't waffle. So what you do is, anytime you mention a point or you elaborate a point, you formulate it and you skim it down into this 3-part system. So you start off by stating the example or the experience that you've had, because a lot of the time in interviews, you're talking about things you've done, as to how it's made you like a better applicant. You reflect on what you've learned and the skills that you've gained and what those different skills are, how they link together. And then lastly, you relate this to dentistry and how it makes you a better applicant. The reason why this is kind of like a foolproof method is because it stops you from basically waffling, as it's giving you the exact points. It's presenting the exact points the interviewer wants to hear. An interviewer doesn't necessarily care about this example here, the state part. This is only to set the scene. Okay, a lot of people get this wrong. They think state is the most important thing. Like, they think, oh, what's the coolest example I can mention that shows that I'm a leader? It's like, no, I don't care about that. The thing that I care about as an interviewer is this: your reflection, and then secondly, how it relates to dentistry. Now, you might be wondering why. The reason for this is, when you're reflecting on something, okay, you're delving into how that experience, has changed you as a person when you're reflecting on that experience, okay? If Faris and, I don't know, John are both on the football team. I don't know why I'm saying this, I'm dead at football, but we're both on the football team, okay? The example is exactly the same. So there's no value in the example. The value comes from what I learned from that experience. It's the reflection that I make. It's the skills that I gained. It's how I talk about the importance of teamwork, leadership, decision-making, critical thinking. That is the value when it comes to answering your questions. So basically, you're going to be hearing me talking a lot about reflection during this entire presentation and just in general, because that is so essential. And it's the best way to stop you waffling, is by ensuring that you just reflect, talk about the skills you've gained. And then finally, this idea of relating to dentistry. Now, there's no point in you doing all these cool things and learning all these amazing skills if you don't know why you're doing it. You need to understand that, in kind of a cutthroat way, you are competing against thousands of people in the country, okay? And why are you competing? You're competing over a place in dental school. So you need to explain how these experiences have allowed you to not only gain new skills in your reflection, but how these skills are directly related to dentistry and why it's going to make you a better dental applicant. That's kind of it. Like, if I could kind of end my presentation here, like, this is the most important thing, is just understanding the value of that reflection and how to relate to dentistry. But we're gonna talk about some more things. Don't worry, I'm not just gonna leave you guys with this. And then this is another point that I wanted to make, which is this idea of allowing the interview to flow. So you have to remember that an interview is a conversation. It's not a one-sided thing. If they just wanted to hear you talk, they would send you the question, they would give you, a load of time to just answer it and script an answer, and you could just send it like on email or something like that. But the point of an interview is that you have a human interaction. You have a conversation with the interviewer. So I want you to always remember that, the idea that the interview is an interaction between you and the interviewer. And to further this point, I want you to remember that you should not be speaking for the entire amount of time. Now, people have this thing where they think, oh, Faris, this interview says it's 5 minutes per station, but I don't know how to speak for 5 minutes. I'm like, you're not meant to speak for 5 minutes. The 5 minutes is just a guide, for that interview question, like the maximum amount of time that you're allocated. However, the actual intention is to use that 5 minutes effectively. It's kind of part of that organization time management. You want to articulate your points in the least amount of words possible. Okay, I want to repeat that again. You want to articulate your points in the least amount of words possible. The less time you spend answering a question, making sure that you hit all the points and you're speaking well and you cover everything, that actually shows that you are more concise and you're better at your job. Okay. Equally, it gives you an opportunity to have a conversation with the interviewer, because when you don't speak for the whole 5 minutes or the whole 7 minutes or however long your station is, it gives time for the interviewer to delve into what you've stated and delve into the points you've made. Bear in mind that you don't know what the interviewer is looking for specifically. And you might have said a load of stuff okay, that you think is relevant, but the interviewer wants you to elaborate on one particular point. You're never going to be able to have the opportunity if you just talk for the whole 5 minutes. So that is this idea of allowing the interview to flow. Someone's asked in the chat, I'll just answer this very quickly. Ula asked, how long should we spend answering the first question in a 5-minute session? Fantastic question. The answer is you should be spending the least amount of time that you can whilst answering the question to the best of your ability. So it's one of those wishy-washy answers that I can't give, like, it's for different people, it takes different amounts of time. Someone can do that very, very well in about 2 minutes. Someone can do it in like a minute and a half. Some can have to take 3 minutes. It depends on your talking style. But generally speaking, you want to, my personal recommendation, what I think, but I do not think this extrapolates to everyone, is you should be spending, you know, like maybe 2 minutes, 2.5 minutes max, like talking, like max. Because think about it, like continuously talking for 2.5 minutes is a long time, and give the rest of that time for more development. And then you guys might say, but what if there's more things I want to say? Which is a very valid point, even though no one said it, but I'm assuming someone's thinking it. That's fine. Just because you've stopped, it doesn't mean that like that's it, what you've said is done, is over. It just means that it allows you to, and look at point 3, stop and think, because it allows you to stop and think. It allows you to identify, okay, what else can I say? Let me see if the interviewer has anything to say to me. No, they don't. Okay, let me keep talking. See what I mean? So it's this idea of answering for 2 minutes, or like not answering for the whole amount of time, doesn't mean like you just answer for, you know, once you hit a certain point, you just stop talking. It just means, you know, allowing a little bit of breathing room, allowing an opportunity for the interviewer to come back and forth with you, rather than you just talking at the interviewer. These, like this slide and the, it's not letting me go back, which is annoying. Yeah, this, oh, here we go. Yeah, so this slide and this slide are very important. This idea of letting the interview flow and being short and concise. And I hope, and these are things that are like quite hard to articulate, like when, you know, when I'm helping people with interviews, but hopefully this makes sense. And yeah, I've got a lot of questions here in the chat. As I said, guys, we'll go through these more at the end. Just save them in the Q&A section. But thank you for asking them. So this is another method that you guys have probably heard of. It's called the STAR method. This is really really good way to kind of standardize some of your answers when it comes to like skills-based questions. So what you do with the STAR method is you state a personal example, that is the S, the situation. In the task bit, you say what you actually did. Action, how you did it. Result, what was the result? And then you reflect and relate to dentistry. There was another R, but I got rid of that. So these are the most important. Oh, sorry, no, I'm wrong. I just can't. Result starts with an R. So yeah, these are the 3 R's. Top tip from me though, because this is quite a standard thing that you read online. These 4 like aren't that important. The most important things are reflection relating to dentistry, because these are the things that show that you've developed new skills and explain to the interviewer why it's relevant to dentistry. Okay, hopefully that makes sense, and hopefully as we go through some examples, you guys understand why that's important. So this is a Q&A model. Answer example. So this is like kind of what I would do with an answer. So I'd say something like, you know, situation, sorry, the question is tell me a situation where you showed leadership. Situation, I was house captain at 6th form. Task, I led my team in organizing the school quiz. I know, super cool. Action, I delegated tasks to all members of the team, effectively time managed and communicated with other captains to gain sufficient information. Then result, then this reflection and relate to dentistry. These are the most important bits. Okay, very, very important. And someone mentioned, like, you know, sometimes it takes a long time to like make your points, but these are covering a lot of things, like, because I'm interleaving my reflection in here as well, because I've mentioned this idea of effectively having time management and communication and how it allowed us to organize events. So basically my point here is follow this kind of structure, ensure that you reflect and relate to dentistry, but at the same time understand that you can interleave reflection kind of anywhere in your answer, because it's very easy to do. Does this all make sense so far, guys? Let me know in the chat if everything's making sense, if anything's confusing. Yep, making sense. Okay, fantastic, fantastic. Okay, so as I said, we said this is going to be a nice interactive session, and this is going to be our first interactive task. So we're going to try this question. I want one of you guys to volunteer and try and answer this question. It's going to be the same question. Tell me a situation where you showed leadership skills. So if anyone would like to do it, just put in the chat, you know, I'd like to do it, and then you can unmute and start answering. I'll give you guys a moment. Don't be nervous. I'm a nice guy, promise. Anyone that wants to answer this question, tell me a situation where you showed leadership skills. Let's see. Okay, Amira has said she'd like to do it. Okay, Amira, if you'd like to unmute. Firstly, thank you for answering, volunteering to answer.
Hi, can you hear me?
Yes, hello. Can everyone hear Amira? Hopefully, just put in the chat. Yep, okay, fantastic, Amira. Okay, great. So, Amira, thank you for volunteering. As you know, the question is going to be, tell me a situation where you showed leadership skills. So yeah, how would you answer this question? First, we'll kind of talk about your thought process, then you can get into actually answering it.
Okay, so I guess I'll probably use the STAR model because I think that's what I'm most used to right now. And I would say something like, a time that I showed leadership was when I was head girl, in that I was responsible in ensuring that the senior prefect team was working cohesively, and I had to set up a rota as one of the large roles in our position was to chair or monitor the student-led cafeteria. In this, it was really important to consider everyone's strengths and weaknesses in what they could do within monitoring it, whether they were very good at communicating and speaking to younger students or were better working in the stalls. It was quite difficult as it wasn't necessarily a job everyone wanted to do. And so it was very important I was able to manage expectations. I think that being able to communicate with the team and explain that this was something we had to do, and explain that I would be non-judgmental and fair as I possibly could, ensure that everyone was on board with what was happening. I would say that this meant that we were able to work together, and ultimately everyone felt that they were being heard and listened to in the process of making the rota. I would say that this has been a really valuable experience for me because it definitely showed me the importance of being able to understand people's emotions and look at things from their perspective in order to relate with them and be able to continue working collaboratively. And I'd also say that the act of being a leader in this role is definitely relevant as I pursue a career in dentistry, because I'm going to work within the multidisciplinary team. And I think it's really important to be able to manage conflicts and work with other people in that situation.
Great, fantastic. Great answer, Amira. I think that was a good way to start, actually. Not much to change there. What did everyone think of the answer? Put in the chat things you liked, what you didn't like. And while they're doing that, Amira, how did you feel you answered that question? Did you find that easy, hard?
I think it was all right, but I might have spent a bit too long explaining what happened.
Yep. Yeah. One thing I'll note though is, and this is just to everyone, is did you see how that wasn't a super long answer? But that's a good thing, by the way, Emma. Like, just making that clear. Like you said a lot, but in terms of time, you didn't spend like the whole 5 minutes speaking. You know, you got straight to the point. You started telling me about your experience. You gave me a bit of reflection. You related it to dentistry. And the brilliant thing about that is, because you've not used the whole 5 minutes, in a real interview, it gives me the opportunity to delve deeper into what you've done. Like me, I might talk a little bit more about, you know, that designing of that rota, or what the exact leadership skills you saw in like your work experience, or why you think it's important in a multidisciplinary team. But the good thing in your answer is that you've been concise, straight to the point, and I think I was pretty well rounded. And yes, everyone's saying good reflection. I do think it was a good reflection. Some extra point, so well done. Some extra points I'll just say with regards to just reflection, is really good to just link different skills as well with reflection. People get kind of stuck in the box where they think, oh, it's a question on leadership, I can only talk about leadership. It doesn't mean that. It's good to focus on leadership, but it's also important to note that every skill is not sole, is not an individual thing. They relate to each other. Like, you cannot be a good leader without having good teamwork skills. You cannot be a good leader without having good communication skills. So within your reflection, maybe talking about how, as you know, within this leadership position, you realize the importance of being a good communicator. Through this, you identify different communication methods that you utilize with your team in order to maximize your efficiency. Things such as altering your tone, altering the speed at which you speak, in order to make people feel comfortable in their situation and provide be the best leader possible. Something along those lines, where you're kind of, you know, mentioning other skills and relating it back to leadership. That's a good way to reflect, and gives the interviewer a little bit more, you know, a bit more content to delve into. Does that make sense? Amira, does that make sense?
Yes, it does.
Fantastic. And yes, hopefully that makes sense to everyone in the chat. Hamza asked, what if you have a stingy interview who's not willing to ask as part of their own? Fantastic. That's even better. Why? Because when you have a bit of that silence, it gives you an opportunity to make more points. Just because they're quiet doesn't mean that you have to be silent too. Like, you can think of new things. You can be like, another thing that I also learned, this, that. Like, don't be put off by the interviewer. You don't know what they've been told to do. You don't know if they've been advised to just be completely silent. You don't know if they've been advised to ask you very, very difficult questions or pinpoint certain things. So just the main thing is to stop once you've made your points, allow there to be a bit of discourse, allow there to be an opportunity for talking. If that does not occur, absolutely fine. Mention some new points. Like, you're being time is worth a lot during that interview because every second can be utilized for something else. So yeah, hopefully that makes sense, Hamza. Sarah says, can you relate the last bit of related dentistry student experience you saw in your work experience? Exactly, yes. And that's actually normally what I recommend, because it gives a bit more of a personal element. And usually, like, I kind of do this thing where it's kind of a rabbit holing the interviewer, where you kind of like, you're mentioning so many interesting points and you give them certain things that they want to learn more about. So usually when you mention work experience, they'll want to learn more about the work experience, if you know. So yeah, definitely mention work experience if you can. And then LA asks, is 2 minutes enough for a wide dentistry question? Because that's the pretty question. Absolutely. I personally think you can do a wide dentistry question in like a minute and a half. But we'll go through that later and I'll explain my logic there. Fantastic. Great. So next up, this is everyone's favorite type of question, obviously. It is the ethical scenario. Now, this one is difficult. I'll be honest with you. Like, I was being sarcastic when this is the favorite. It's a difficult style of question. Generally speaking, with an ethical scenario, it's trying to see your thought process when it comes to difficult situations, basically. So a lot of the time you'll be given things such as like breaking some bad news or dealing with like a clinical situation, and you've got to kind of be clever in the way you approach the question and in the way that you present your answer. Okay. Some basic things that you should be aware of are things such as the 4 ethical principles. So you have autonomy, justice, beneficence, and non-maleficence. Just know them like the back of your hand, basically. But I'm going to preface this by saying you do not, and I'm going to make this very clear, you do not need to mention these in your ethical scenario answers all the time. Mentioning them, you should only mention them when they're relevant, basically. Sometimes people try and shoehorn them in because they think it'll get them extra marks. It won't. It just interrupts the flow. Remember what we said about interviews? I'm going to go back to the slide. Make sure the interview flows. So don't try and just shoehorn things to kind of show off to the interviewer. Only mention things if they are relevant to the situation that you've been given. Okay. But yeah, know these regardless, because they're quite easy to interleave, but just don't force them in. Next is this idea of considering both sides of the argument. Now, this is one of those things that can be quite difficult because you might be given a situation where you're like, oh, there's only one right answer, but more often than not, there isn't. So you need to kind of change the way you think of things, get rid of your own personal biases, whatever your own beliefs are, whatever you think. You need to think in the mind of a clinician, basically, and think, okay, well, this is the scenario. Here are the pros, here are the cons. Or this is the scenario, here is what you should do, what you shouldn't do. You should always evaluate this idea of having two sides to every coin, okay? Listen and take time to understand the scenario. This is another thing. Guys, it's okay to like sit in silence for a bit and try and think of an answer. People think that they need to answer straight away. That's just not true. Taking a bit of time out, thinking, and providing a clear and concise answer is much better than answering straight away and then getting mumbly and then blah, 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 blah. You know what I mean? Like kind of just tripping off on your words. So just take the time. Next, ensure that you are addressing the patient's concerns first. That is the most important thing. A lot of the time, not always, but most of the time, you're going to be given like a patient case or scenario. So make sure you address the patient's concerns. Understand the reasons behind their concerns. Understand why they have the problem that they have, or why they're acting in the way that they're acting, and act in a professional manner to ensure that you resolve the issue. Because at the end of the day, us dentists, we are problem solvers. That's what we were born and bred to do. Okay. And yeah, some people have a fantastic question where it says, can I tell the interviewer can I have some time to think? Absolutely fine. Yeah, you can tell the interviewer, oh, there's a very interesting question. Can I have some time to think? Something like that. If you want to take some time to think at the start. But I'm just letting you know, like, you're not going to lose marks for doing that. And ask, do you have to give a definite answer? No, you do not. You should be presenting both sides of the argument. If you can make a conclusion, you should. If you can't, it's not the end of the world. It's better for you to have it's much better for you to evaluate everything and not come to a conclusion, rather than like just going down one route and trying to just give one like direct answer. So definitely go down the route of having two sides of the argument. Would you advise sitting on the fence? See, sitting on the fence. If you can provide a conclusion, you should provide a conclusion. That's what I'm saying. In some situations, you don't have to, but you should try and come to a final conclusion or like a solution to the problem. It doesn't necessarily mean that you have to do one thing, but at least like when you conclude, you're kind of, what you do in a conclusion is you're just presenting your argument as a whole and then saying, you know, this is what I would do, okay? Or this is the situation for the patient and they have the opportunity to make the decision themselves. How would you say I don't have an answer even after you evaluate everything? You wouldn't, okay, you wouldn't necessarily say you don't have an answer. That's not how it would work. You'd evaluate the answer, okay? You'd evaluate your point. Let's go into an example because I think it will clear this up, because I feel like you guys are a bit worried about this whole like idea of like reaching a conclusion. So I'll get to that in a second. But yeah, you should come to a conclusion if you can, but you don't have to have like a definitive, like this is what is going to be done, because not all ethical scenarios work like that. Okay, and yeah, and observing the GDC principles. This one I say with a pinch of salt. Again, it's one of those things. It's good to know them. If you can sprinkle them in, great. If you can't, you're not going to lose significant marks over them. But just be aware of what they are. So, should I say this is a GDC principle after you mention the principle? If it naturally flows in the answer, sure. If it does not flow in the answer, no. That's the best way to do it, because sometimes you say it because you're trying to prove to the interviewer you know it, but don't do that if it doesn't flow with the rest of your answer. That's my best piece of advice. Fantastic. So here is an example ethical scenario. So a 7-year-old child with caries has come into your practice with multiple decayed teeth. You explain to their mother that you need to do 5 fillings to save the teeth. However, the mother disagrees and says you are scamming her. How do you approach this scenario? So, guys, I've got the answer here, of course, but pop in the chat what are the main issues you're thinking of when it comes to this scenario right now? Because obviously I've not written everything here. So what are the main things you think of when you have something like this? Pop it in the chat, unmute, and give me what you think. Let's have a look. Yeah, a lot of people are throwing Gillis competence, autonomy. Do they know everything about fillings? Yeah, providing them information, fantastic. Autonomy, GDC. Okay, everyone's just throwing autonomy. Okay, autonomy. Yes, autonomy is very important, guys. It's not the only thing. What else is there? Yeah, Hannah's made a good point here. I like this, Hannah. So Hannah's mentioned autonomy, consent, pros of the fillings, risks of not having fillings. So yeah, so this kind of leads into this idea of gaining informed consent, which I'm going to go through in a second, but that was good. Patient could be at risk. What does that mean, Barney? If you can expand on that. Zupash says communicating effectively. Yep. Providing the best care for the child. Perfect. Reasons why they don't want a filling. Exactly. This is very good. Thank you, Farah. Reasons why they don't want a filling. That's really important. This comes under this idea of addressing the concerns. It's not just, you know, because you might think as a dentist, like, oh, this is what needs to be done, blah, 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 blah. It's not. It's understanding, okay, why exactly don't they want this filling? What's putting them off? Second opinion, fantastic. Ask some other questions to get to the root of the problem, okay? Preventative care for the future, fantastic. Multiple decayed teeth can have a negative effect on their general health. Yes, but that, I'm happy you mentioned that. You can talk about that as like a reason why they need to sort out the multiple decayed teeth, but don't go down this whole like alternative route of like the oral systemic link, because it can be a bit of a headache. Explore the reasons why the child has so many teeth. No, I'll be honest with you, no, don't do that. I'm happy you mentioned that though, Samir. So some of you guys are kind of like introducing new points that are not necessarily being stated here. This is an ethical scenario. It's asking you how you would approach the scenario, how you're going to deal with the mother. Don't Don't go down like other things that are related to the topic. Don't be thinking about like well-being of the child and things like this. You're just overcomplicating it for yourself, and you're making the answer more difficult than it has to be. Keep it simple, keep it nice and easy so that it can flow easily. Fantastic. Fantastic. Mother may, yes, good. Mother may have had a bad experience. Good. Are you able to say having compromise? Yep, you can talk about compromising. Yep. Another treatment plan. Good. Okay, cool. Lovely. Everyone here has mentioned some pretty good things. So let's go through what I've written, and then we're gonna like kind of discuss it together more. So first and foremost, you must address the concerns of the mother and find out why she thinks you are scamming her. She may have had a bad experience in the past and is skeptical of dentists. So this is this idea of addressing the concerns, understanding why the patient, or the mother in this case, is upset and does not want to go ahead with the treatment. That's the most important thing. We do that before, getting annoyed and thinking about why are they doing this? Why are they saying I'm scamming her? I'm offended. It's like, no, be a professional, understand that they may have had a bad experience in the past. Do not belittle or dismiss the mother's concern or be offended by her judgment. You must act professionally, GDC principle, and absorb the viewpoint of the mother. Next, you should explain the treatment to the mother and why you think it's the best clinical decision for the child. You can mention alternative treatments, outline the long-term consequences of the plan you've mentioned. You can also another thing is, bear in mind that just because you think like, you can say this is what I'd recommend, but that's not the only thing you recommend, in the sense of there's other treatment options. So with anything in dentistry, so just so you don't get sued in the future, guys, generally speaking, there's never just one answer. There's multiple different answers. There might be certain things that are more accessible due to finances. There might be things that may be more accessible due to materials or due to the patient, to the dentist's own skills. So don't ever think that there's only one answer. So you should always talk about alternatives. And for every alternative and any treatment that you ever mention, you always mention the pros and cons, the risks of doing it and the risks of not doing it. Okay. And the benefits of doing it, benefits of not doing it, like the same, same sphere. When you do that, and the reason why we do that is because we are trying to ensure that the patient understands what's going on and is able to make a more informed decision, and thus you're able to gain informed consent. Informed consent basically means like the patient understands what's going on. Okay, and as a result of that, can consent, and they have the mental capability to do so as well. Next, you must respect the fact that the child is below 18. Informed consent, as I've just mentioned, must come from their parent or legal guardian, and thus you must respect the mother's autonomy in their decision making for her child. Okay, and lastly, even though you may think you know what's best for the child, the final decision is up to you. So yeah, alternatives. Yeah. So hopefully now this is kind of explaining how, you're not necessarily, do you see how there's not necessarily there's not a specific conclusion where you said, so as a result of that, this is what I'm going to do. It's more evaluative in that you've laid everything out, you've explained everything to the interviewer, and your conclusion is just, summing everything up, saying, and as a result of this, I would have this discussion with the mother, explain all the different treatment options, and allow her to make a decision to see what will happen in the future. Hopefully that explains what I mean by saying like you don't always have to have like a direct in conclusion. Yes, so Jackie asked, if this is a role play scenario for this queue, can we say there are other treatment options, but not specify what they are because you don't have the knowledge? Yeah, that's absolutely fine. Do ethical questions come up in panels? They can come up in panels. Unrelated to question, do you need both parents to agree for consent to be obtained? What if one agrees and one doesn't? Oh, it's a very, very good question. Huh. I think in that scenario, I'll be very honest, I'm not 100% sure. I've never been asked that before. I personally, based on my view, I think what you'd normally do in that scenario is you'd have a discussion with both the parents. You'd tell them, if you guys can have a discussion, you wouldn't make a clinical decision, basically. That's the most important thing. You would tell them, can you guys have a discussion? Maybe call them in for the next appointment, and by then have made a final decision. But you don't have to make the decision straight there and then. And you wouldn't make a decision until you've got that, complete consent. Yeah, so far as so the conclusion is just a summary of the for and against, but giving your opinion how to approach the scenario. Yeah, basically. But do you see how it's not like this is exactly what's this is what is going to happen? It's just evaluation, analysis, providing a general gist as to what the right choice is. But you're not necessarily saying, as a dentist, I would do that. Do you see what I mean? I just want to make it clear for you guys, so you know, because the reason why I'm like this, I'm being a bit wishy-washy, is because it's very, very risky to use like absolute language. So saying this is what I would always do, this is what I definitely do, this is what I would never do. Because the second you use absolute language that's very, very extreme, it indicates that you're, you know, rigid with the way you're thinking. So I want you to have more fluidity in the way you answer these styles of questions. Okay, so role plays. These are the other favorite styles of questions that people have. So, yeah, so Gillick's competence, you really, like, people overthink Gillick's competence. You don't think about it too much. Don't mention it if you don't have to. So don't think about Gillick's competence. And I know you guys want me to go into detail about it, but a lot of the time, as a dental applicant, you read things online, you're like, oh, I need to know everything. And then when you get into too much detail, you're generating details that are just going to put you down a rabbit hole in your interviews that you don't need to do. You can mention that, you know, this child probably doesn't pass Gillick's competence. Going into absolute detail with it is a sure way to lose marks, because you don't know everything about the topic. Hopefully that makes sense. Anyway, let's get to the role plays. And in the Q&A, I'll go through some of these in more detail, guys. So role plays are a good way to assess your communication skills. They're not always related to dentistry, so many times you'll be given random scenarios and asked to, act out how you'd react in the situation given. Bear in mind, a lot of the time there'll be paid actors that make the scene feel very real. So I remember one of the mocks that I did, I had, I think it was like one of my teachers, they had to act out that I had, I don't know, I think I was a veterinary surgeon, and I'd amputated their hamster's leg by accident. And they really got, like, he started crying, made it very serious, and you had to be like very, very like serious in it. So just remember, like, you might be given some very, very random role plays. Can you get role plays and panels? I don't think so. I don't think so. But again, you can be asked anything in any type of interview. Can you get actors in an on-time interview? Well, of course, they can hire an actor for an online interview if they want to. Yeah, so bear in mind, a lot of the time they'll be paid actors. Yeah, ensure you're empathetic, articulate, polite, and realistic. Empathy is a key skill. Understanding that, because a lot of the time what happens is, you're as a student, a dental applicant, whatever, when you're talking, you're trying to be logical, professional. You're trying to show the interviewer you know what you're talking about. But sometimes being super duper professional and like logical, because you know you're trying to articulate yourself well, comes at the cost of being empathetic. Always remember that empathy is one of the most important things in these scenarios, because you will usually be breaking very, very difficult news or dealing with difficult situations. And as a result, you need to have that empathy within you. And some of the easy ways to practice empathy within these scenarios is to just really slow things down, especially when you're with a patient, just giving them time to process grief. Don't think of it as, oh God, I've used 2 minutes in my interview already, I need to start talking. Just remember, like, silence can be your best friend, and allowing yourself to kind of listen to the patient, give opportunities for the person in front of you to talk to you, and actually understand what's going on will allow you to provide a much more empathetic and better answer. Yeah, so again, I'm going to go through some of these questions in the Q&A, because we're getting quite a few, and yeah, there's quite a lot to go through. Well, not now, but I'll do that at the end. So, and yeah, we'll go through some role plays in the Q&A section. Don't worry, guys. Don't stress yourselves out. Yeah, so this one, why this university? So this is really important with university style questions, is to make sure that you've read the course details. Course details, oh my God, they are so boring. No one wants to read them. No one wants to learn about them, but you really need to make the effort to go online and research things about the different universities you're applying for. You're going to be there for 5 years. You might as well know how they teach you, okay? Parminder, you've asked a very good question. Please ask that again in the Q&A. Actually, no, I'm going to go. So, okay, hopefully, okay, I just realized something. Guys, with this type of question, it's not like you wouldn't be talking at me. You would be doing the role play. We'd be acting together. So I would like, it'd be like, oh, a patient has come in and they're really, really upset with the filling that you've given them. Console the patient. I would, as an interviewer, I would act as the patient. I'd start crying, like, why did this to me? And you would be the dentist. So you'd be like, you know, this is, hi, nice to meet you. I'm Dr. Al-Sayed. Please have a seat, blah, 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 blah. See what I mean? Like, it's not you narrating, it's you actually doing, yeah. So hopefully that makes sense. Don't worry, guys, we'll do this in the Q&A section. So Make sure you read the course details, as I mentioned, with the universities. When you're answering, make sure you speak clearly and concisely and show your passion for the university. Ensure you've read about the area, the teaching style, societies, news, events, and also read about research. Oh my God, this is so important because I'll tell you now, in one of my interviews, I started talking about research from another university completely, and I got the dirtiest look I ever got in my life. So make sure you read about the research because it really shows that you're actively learning and you're trying to learn more about the course you're going to dedicate the next 5 years to. Remember, guys, it's a long time. And recognition of research shows that you're generally caring about the availability of information when it comes to dentistry. You're learning about things before you even need to know them, technically, because you're just a dental applicant. So yeah, okay, let's do an example question like this. So has anyone got an interview coming up for one of their universities? All right, Neva, you're the first one. Would you like to do a why this university question? We can try us out and I can give you some feedback on it. Yes, please. Okay, fantastic. Neva, if you'd like to unmute.
Hi.
Hi, do you mind if I call you Neva or Neva Sheeny?
Yeah, no, everyone calls me Neva, that's fine.
Okay, fantastic. Great. Okay, so what university do you want to practice for?
King's.
Oh, fantastic. All right, you've chosen the right person. Cool. All right then. So guys, what we'll do here is I'll ask Neva the question, she'll answer, and then after we'll kind of evaluate together, give some feedback. All right, Neva. So I'll ask you the question. Why do you want to study at King's College London?
So there are 3 main reasons why I would like to study at King's College London. The first reason is because of the diversity. London is a very diverse city and is very multicultural. So I think by studying at King's, I will have a great range of exposure and learn to treat different patients with different views on treatments and different patients who maybe look after their oral health in different ways because of their economic and social backgrounds. The second reason why I would really like to study at King's is because of the societies and the events that King's holds. So I really like the wide range of societies like the chess club society, but also the sports events and the dentistry specific events that happen. The third reason why I really like King's is the range of things to do in my free time. So I know that dentistry is a really stressful course. So having places to go in your free time where you can relax is really important. And London has a wide range of things to do. You can just go on a walk somewhere really nice, or you can do an activity, and there's so many choices of activities. So I think these are 3 main reasons why I would really like to go to King's.
Okay, fantastic.
I wanted to talk about the course as well, but then I realized I said 3 at the start, so I couldn't.
Yeah, so great. You might have done a course or something where you got told to like kind of define the parameters of your answer, where it's like, I'm going to talk about 3 things and then you talk about the 3 things. It's a good way to stop yourself from waffling, but also, as you just mentioned, kind of limits you in what you can say. Generally speaking, the answer was fine. Guys, put your feedback in the comments. Sorry, not YouTube. In the chat while I'm going to give some feedback while I'm speaking. So, you mentioned the 3 points were dealing with it's a multi-diverse city, dealing with people from different regions, from different experiences, economically, culturally, etc. The second thing was this idea of societies, so joining the chess club, dealing with different range of societies while you're at university. And your final thing was that there's a range of things to do. Dentistry is a stressful course and you want to have a lot of hobbies and things to do while you're in London. So guys, what did you guys like about the answer? What did you guys not like about the answer? Really thoughtful and thorough answer, great answer. I think you should choose a specific society. And talk about it, give examples. It was great, but I feel like you need a specific example. Which dentistry event at King's? What activities you can do in London? Talk about teaching style and research. Yeah, everything here is quite good. Sounded a little bit rehearsed. Yeah, I'd say one of the things you need to be aware of is the way you speak. So this is just a general tip for everyone: when you're speaking, just bring a little bit of passion into your answer, even if you're not super passionate. So it's kind of like fake it till you make it, in a sense. So for example, let's say I'm saying, oh, I really want to study at King's. I find it a really interesting university. There's a load of really interesting societies there, and I'm really excited to attend. I can say that, or I can say, oh, I'm really interested to study at King's. There's so many interesting societies for me to get involved with, and I just can't wait to start. Changing my tone, the way that I speak. I realize I'm moving my hands a lot. Changing the tone in the way I speak, even though the content of the answer is the same, adds a little bit of flair and a bit of character. And that's something you guys should try and practice. It's just changing your intonation, the way that you speak. Something really weird and odd, but I'm just going to say it is smiling when you talk. Naturally, when you're smiling, when you're talking in a little bit more of a joyful way, in a happier way. So little things like that, just to give a little bit of personality to your answer, because it's definitely important to ensure that you don't sound robotic and that you sound like passionate. I didn't think it was too bad. Neither, to be honest, but it is something to bear in mind, just to ensure that you speak clearly and have a bit more flow. Someone said maybe a shorter answer. Honestly, I didn't think the length of the answer was a problem. Does it look bad if you move your hands a lot? I moved my hands a lot and I was fine. Do you recommend mentioning professors? You can mention professors if you want to. You don't have to if you don't want to. But yeah, sorry, let's get right into the details. So what did I like? What didn't I like? I liked that there was a bit of structure to the answer. So you mentioned the different people in regions, societies, and then at the end, the hobbies and the different things that you want to do around London. I particularly like when you relate to dentistry. So you mentioned dentistry is a stressful course and you need a wide range of things to do. What I would have preferred is more reflection. Now, guys, what did we say? What are the three things that you need to talk about when you're answering a question? The SRSR method. What are those three words? Let's have a look. Yeah, state, reflect, and relate. Exactly. So let's dive into this and see how we can do that better with this type of question. So you mentioned this idea of different people in different regions and wanting to have different experiences, but you didn't really explain to me why you want that. Do you agree with me, Neva?
Yeah.
Yeah. So what I want is a little bit more, delving into the details. So telling me why you care about that. So Neva, why do you want to be in a multi-diverse city and treat people from different regions?
I can learn more.
Okay.
And learn how to deal with different patients.
Okay. And why is that relevant to dentistry? Why do you want to learn how to deal with different patients?
I can just be a better dentist because I can suit my treatment to different patients.
Great. And what's a nicer way of saying suit your treatment to different patients? What's a word that kind of talks about, being able to, I don't want to say it, to deal with different types of patients? If anyone can think of it and put it in the chat, or if you know it, Neva, go ahead.
Flexible, adaptability.
Yeah. Exactly, adaptability. So what we could do now is, let's say you're going to answer this again. You can say something like, one of the reasons why I'm really, really interested and excited to study at King's is because it's based in the heart of London, which is an extremely diverse city. Through this, I get to deal with different people from different backgrounds, culturally and socially, and it's going to give me a great exposure to people from these backgrounds. This is really, really, really important because it allows me to develop my adaptability when it comes to different patients, something that I'm going to be dealing with a lot as a dentist. Being able to adapt and think on and be quick on my toes when I'm dealing with different patients is important to ensure I provide the best patient care possible and that I can be a more competent and professional clinician, something like that. So now what I've done is I've expanded a little bit on your answer, but I'm not talking, if you realize I didn't really talk that much about like the London that much. I kind of set the scene and instantly I'm starting with the reflection and talking about the different skills that it would make me gain and why it's going to make me a better clinician. Does that all make sense? Does it make sense, Neva?
Yeah, thank you.
Yeah. And yeah, you can talk about interpersonal skills as well if you want. Fantastic. And do you guys understand what I did there? So why I kind of split that into that reflection and that relating to dentistry. Did that make sense? Let me know in the chat. And then, yeah, and for the other two examples that you mentioned, so you mentioned this idea of societies, I would, look at a particular society and then say why it's important to be part of societies. You can talk about work-life balance, and then you kind of alluded to it when you talked about how dentistry is stressful. So talk about this idea of developing a good work-life balance from early, and also by getting involved with different societies, it gives you the opportunity to gain skills that you may not necessarily gain while you're in dental school. So, going with different societies, being a leader, with like being a president, or being like part of the social media team, getting social media skills. You see what I mean? Like I want a bit more creativity when we're thinking of that reflection and relating to dentistry. Do you see how, that's where you get more that's how you can like stand out from the crowd. It's not by talking about the things, because everyone can mention like the multicultural societies, etc., but not everyone can reflect to a grand amount. So hopefully that makes sense to everyone. And yes, thank you, Niva, for answering. And yeah, hopefully guys, that gave you a bit of insight into how you can, because this is one of those questions where everyone thinks like, how can you make it more unique? Like, you're just going to talk about the course and you're just going to talk about the city. But I've just proven to you that you can do that, because you need to just be more clever with your reflection. Identify skills, talk about why they're important, how they've improved you as a person, how they make you a better dental student or a better dentist. Hopefully that is all making sense. Cool. Yes, well done, Niva. Great. So data analysis questions. So these types of questions are quite common as well. So this is like basic things like analyzing graphs, describing a picture, values, math skills. Most important thing here is to look for the keywords in the question. So this is the type of, this was a question like describing questions, like describe the picture questions, that I found really difficult. Because I'm one of those people, as you can see, like I like to go into like, reflecting and like evaluating and thinking about different things. But this question is the opposite. It's like, just be straight to the point, Faris. Like, just say what you see. And that's what you guys should do. Identify those keywords and utilize them. If you see a describe question, just describe what you see in front of you. Just state something. Like, just be straight to the point, very calculated. Don't make it like a large compound sentence, which, delves into different things. Calculate, give me an answer, mathematical. Evaluate, look at this side of the argument, the other side of the argument, try and conclude. Okay. But yeah, most of the questions are relatively easy though. I'll be straight up with you. And yeah, so what I'm going to do now is go through a describe a picture question, my kryptonite, back in the old days. I like to use this method where like I standardize it. So I'll kind of like start from the left to the right, foreground, background, state the main objects that I see, describe the image as if it's a blind person, basically. You've probably heard that a lot of different, online. It's just this idea that you're just being very, very literal and direct and saying, this is exactly what I see. This is what, is in what area. This is the part of this image. This is this is that. You're just being very clear with what you're presenting, basically. And you're not wishy-washying anything. Can you get data questions in a panel interview? As I said, guys, I'm going to be asked this a lot, I can tell. You can be asked any question in panel and MMIs, especially now with the COVID era. The whole like idea of MMI and panel, that clear line that used to be split between them has become very, very fuzzy. So there's a lot of things that are kind of intertwined. So assume that you can get any type of question in any type of interview. So yeah, so we've got this image here. Would anyone like to attempt explaining, attempt describing this picture? If you would, just put it in the chat. I'll obviously like help you through as well. This is like the final question we'll be practicing before we get onto the Q&A section. So, yep. Okay. I think it's Ilahi. Have I said your, I hope I've said your name right. If you want to unmute yourself.
Yeah, it's just Ella.
Oh, Ella. All right. Fantastic. Ella. Yeah. Great, Ella. Okay. Ella, please describe this picture to me.
So what we have in this picture is, in the background we have a lot of trees. So there's a lot of green trees all around in the background. And then as you come closer and closer to the center of the picture, there is a red tent. I'm going to say a red tent just at the top of the picture. Then as you go further down more to the center and the main aspect of the picture, there is a massive group of people. Everybody is basically sitting down with each other and conversing with each other. They are all sitting at different tables and eating food and drinking wine. The people, most of them tend to wear clothes that are white and blue, and some of the people are also wearing hats. The hats tend to be white, not white, yellow and blue. Not all of them are wearing them. 2 of the men are wearing them and 2 of the women. The women's hats, they have flowers on them. But other than that, it's just a massive group of people who are just kind of all sitting together and talking with one another. Also, some of the men in the background who are also sitting at the table, they are also wearing black top hats as well.
Great, thank you very much, guys. What did you guys think of the answer? While everyone's typing, Ella, how do you feel after answering that question? Do you think you answered it well?
I think I answered it all right. I think maybe I could have done it a little bit better. I was just kind of anything I kind of saw, I just said it out loud. Maybe it could have been a bit more structured, but I think as a whole, I think it was all right, I think.
Yeah. Was there anything you particularly struggled with when you were answering, do you think?
I think the background was pretty easy. I think it's just because of the foreground, it not only is the picture, it's a little bit blurry. I don't know, I just kind of I made it too concise, just saying they're just conversing with one another.
Yeah.
I feel like, yeah, that was a little bit vague.
No, I think that was fine. I think you answered it relatively well. I would say one thing is that you don't waffle too much, which I really like. You were clear, you were concise, you kind of mentioned things very like straight to the point. One thing I also say, like as another extra tip, something that I learned recently with answering this type of question, is to kind of first start with like a general overview. So like a general thing, like what you generally see. So generally I see some people sitting at a table, conversing, eating, and then you'll be like, okay, and I'm going to be starting from the left-hand side of the picture and describing what I see. You see what I mean? With that, it kind of gives you more structure. So when you start from like when you say you're going to go from left to right, it forces you to go left, foreground, midground, background, right, or like center, and then the middle, foreground, mid, background. You see what I mean? So having a little bit, just structuring your answer a tiny bit more, because there are some points where like there's trees in the background, and there's this tarp in the middle, which is red, the center, which is red, and then you mention the people, but then you mention the table. Do you see what I mean? It just gives you like, it just forces you to kind of regiment your answer a little bit more. Does that make sense?
Yeah, that makes sense. Yeah.
Yeah. Neva mentioned concise. Maybe don't infer things like they're drinking wine. Yeah, maybe just say that they're drinking like a beverage, but you know, don't stress too much about that. It does look like wine. And yeah, Bradley says, yeah, maybe start from left to right. Exactly. That's the only thing I would have done. Like maybe left to right, but giving like a general overview first, like kind of like a snapshot, like general information. And yeah, fantastic. Okay, great. That's about it, guys. But this is not over. Like I've done this on purpose so that we have like half an hour to kind of discuss and go through things in more detail, but that's like the general overview of interviews. Here are some useful links. I'll put these all in the chat in a second, and yeah, thank you for listening. If you have any questions, please do ask now on the chat, DM me on Instagram, and if you want any one-to-one interview help, do DM me as well. I'm more than happy to help. And then here are some links to my socials. Again, I'll put them in the chat. So yeah,